Can vitamin B12 supplements actually cause your joints to ache? It's a question that comes up more often than you might think, and the answer might surprise you. Joint pain affects so many people, and when it shows up around the same time as starting a new supplement, it's completely natural to wonder if there's a connection. So let's look at what the evidence actually says. Vitamin B12, also known as cobalamin, is a water-soluble vitamin your body genuinely needs. It plays a key role in neurological function, red blood cell formation, and DNA synthesis. It's prescribed for conditions including B12 deficiency and pernicious anemia, and it's also widely taken as an over-the-counter supplement. Here's the important part. There is no established direct link between vitamin B12 supplementation and joint pain in medical literature. Joint discomfort is not listed as a recognised adverse effect in the British National Formulary or in the Summary of Product Characteristics for licensed B12 preparations, and that covers oral, sublingual, and intramuscular forms. Most people taking B12 in any of these forms do not experience musculoskeletal symptoms. So when joint aches do appear after someone starts B12, they're most likely coincidental or related to something else entirely. That could be a pre-existing musculoskeletal condition that was already developing, a concurrent inflammatory or degenerative joint condition, or a sensitivity to excipients, the inactive ingredients in certain formulations, rather than the B12 itself. With intramuscular injections specifically, localized discomfort from the injection site can sometimes radiate to nearby joints, which is worth bearing in mind. There's another layer worth understanding here. Severe B12 deficiency can cause neuropathic symptoms, nerve-related sensations that some people describe as joint-like pain or aching. So in those cases, it's not the supplement causing discomfort, it's the deficiency itself. As B12 levels are restored, those sensations may shift or change, which can sometimes feel confusing. Now, rare hypersensitivity reactions to B12 preparations can occur. Symptoms of a serious allergic reaction would include breathing difficulties, facial swelling, a widespread rash, or dizziness. If you experience any of those after taking B12, seek emergency medical attention straight away. You can also report any suspected adverse reactions via the MHRA Yellow Card scheme at yellowcard.mhra.gov.uk. If you're currently taking prescribed B12, particularly for confirmed deficiency or pernicious anemia, please do not stop taking it without speaking to your GP or pharmacist first. Stopping treatment for these conditions can have serious consequences. If you're experiencing joint discomfort and you're on B12, it's worth having a conversation with your GP or pharmacist. They can help work out whether the two are genuinely connected or whether something else needs investigating, including the specific formulation you're taking, any other medications or supplements, and whether further tests might be helpful. In terms of when to seek prompt medical advice, if you have severe joint pain or a joint that's hot, swollen, and accompanied by fever, don't wait. Contact your GP. Those symptoms need proper assessment. So to recap, vitamin B12 does not have an established direct link to joint pain, and it's not listed as a recognized side effect in clinical references. When joint discomfort does occur alongside B12 therapy, it's typically coincidental or related to other factors. And if you're on prescribed B12, always speak to your GP or pharmacist before making any changes to your treatment. This video is for general information only and isn't a substitute for advice from your GP or pharmacist. So if you have concerns, please do reach out to them directly. If this raised any questions for you, drop them in the comments below. And if you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health content.